Hi, I'm Jim Berkland, editor of McKnight's Long-Term Care News, and I'm here with Larry Minnix, President and CEO of the American Association of Homes and Services for the Aging, at the group's annual show in Los Angeles. Now, Larry, the elections just took place, and a lot of people are wondering what the impact will be of the Republicans taking control of the House, and I was actually very interested to hear you be somewhat confident that not a whole lot will change in the way of reform in some ways.
Well, our needs are the same as they've been, and we know that there are Democrats and Republicans and understand their problems with Medicare on the nursing home side. You've got Medicaid issues. We don't have enough money for Medicaid. We've got some parts of health reform that need to move forward. Innovation is the only way out of the mess that we're in. We've had enough contacts with Republican leaders that had worked with us previously to know that they understand a lot of these issues. Obviously, there are different approaches, so the needs are there. There's a general recognition that we've got to do something about them, and so we'll be working with a Republican House and a Democratic Senate, and continue to work with the White House and the administration on this.
But some of the vows of Republicans to overturn or repeal reform, you don't necessarily think that that will take full traction?
Let's look at the politics of it. We know what the rhetoric was. Now, the issue is, okay, what do we repeal? Coverage for children? Do we want to repeal the donut hole? Do we want to repeal something as far-reaching as class? Do you want to repeal provisions that do away with guaranteed coverage for people? I don't think so. So if there are improvements that can be made, I heard Senator Reid say on television that he's open to that. Certainly we are, but we've got an aging population that is making huge demands on resources in this country, and we all know that care can be better less expensively by doing things differently, and that's the big issue, is how do we begin to do them differently. And maybe this election is sort of a sobering time to think, you know, it's time to stop arguing and start solving.
Okay, and looking to the future, ACOs are really a big topic. Where do you see those going, and what can providers take from it?
We have spent a lot of time in our leadership groups over this past week. We had Dr. Mark McClellan in, we've had consultants in, and we believe our members are poised to be part of accountable care organizations. I asked for a show of hands in our major leadership groups, and I would say that at least half of our members in larger organizations or leadership groups are reaching out to hospitals, doctors, among themselves. There's several different models. The solution to the future is better coordinated, integrated care, and that's what an ACO represents. There may be other types of models, but that's the construct that's getting the discussion started, and people's lives are not siloed. Care delivery can't be siloed anymore.
There's no way around it.
No way around it.
Okay. One other topic I
Sure.
did want to ask you about is in recent weeks, certain members of other nursing home associations and organizations, advocacy groups, have expressed a desire to come together with AAHSA, leading age, certainly coming in, and we were wondering, where do you see that coming forward, and how will you be working together with them? How do you see that might work?
Well, as you know, we have a number of friends out there that we have a lot of things in common with. So I would imagine we will continue to work with AAHSA and the Alliance around nursing home quality and trying to get that right. It still isn't right. We'll be working with them on Medicare and Medicaid, as we always have. We'll be working with disability and consumer groups on things like class. We're working with every sector on quality improvement around transitions. So one of the things we spend a lot of time on is what is our relationship agenda with important organizations that we have things in common with, and obviously we have a lot in common with AAHSA and the Alliance, as we do with Alpha and the Consortium for Citizens with Disabilities and Paralyzed Veterans and Relationship management and synergy is one of my major responsibilities.
Thank you very much.
Thank you, Jim. Thank you for your continuing good coverage of all of our issues.